I welcome very heartily Dr. Matthias Lechner. He's from Austria. He studied medicine at the University of Vienna and then had a very broad TCM training with Karl Hermann Hempen, Fritz Friedel, Christian Schminke, Volker Scheidt, Radha Tambi Raja, and others. Just to give you an idea as well, he was in China at the TCM universities in Nanjing and Hangzhou. Since 1997, he's practicing acupuncture and Chinese phytotherapy in clinical settings, and he is trained in the body therapeutic methods of osteopathy and Glaser's psychotronics. This is the same just we have been hearing about. He is working in his own practice in Vienna, regularly teaching TCM, phytotherapy, and acupuncture at the Danube University in Krems and at the Austrian Society for Acupuncture. Also, he is the vice president of the Austrian Society for Acupuncture. Welcome. Are you here?
Yes, I'm here.
Okay, welcome, and the floor is yours. Thank you for coming.
One second, how do I activate my PowerPoint? Wait.
You have to open your PowerPoint.
Yes.
Then go back to Zoom, and then go to the down of the page where you see the small green sign.
Wait. I open PowerPoint, then I go to the
Zoom.
I'm in the Zoom.
And then you go to the back of the down of the page, and you see a small green sign.
Green sign, got it.
Yes.
Yep.
And you click on this.
And I click Freigeben. I click on this. I did Freigeben. Okay.
Yes. And now you have to choose your present. Yes. Voila.
Voila. Super.
Perfect. Only you have to enlarge it to make the presentation mode. Yes, perfect.
Okay. Now I have 20 minutes. Is that true?
18 minutes and 2 minutes for question and answers.
Okay. So it's a big topic. My topic is prevention of migraine with acupuncture. And well, it's stormy weather in the head. It's an extreme common disease. Recently in the Lancet, they said it was over 1 billion people worldwide. And about 14% of humans have migraine attacks in one form or the other. So in a neurologist practice, headache and migraine are the most common complaint. And also migraine, it's also pain. And everything what Nicolas just said before applies to migraine also, I think. So this is what he said, the basic fear and the relating issues and all that. And this is kind of underlined that migraine often coexists with non-headache common pain like low back pain and so on. So there's a kind of symptom imperative, and migraine might be part of it. There's a lot of suppressed emotion and stuff. But that's not what I'm talking today about so much. I'm more talking about this practical treatment of practical hands-on treatment of acupuncture, where we, even if we don't do elaborate psychosomatic treatment, even have good results, like with some drugs, and we have less side effects. Just very briefly, causative factors. There's a lot of discussion. The current theory is some dysfunction of the trigeminal system with release of vasoactive factors and inflammation and a lot of sensitization. So the brain is oversensitive in migraine. There's different forms. There's one migraine without aura. There's always commonly nausea, photophobia, phonophobia, you all know that. And there's a different type migraine with aura with neurological symptoms. There also might be forms where people don't get out of the migraine attack. It's longer than 72 hours. Then we talk about of status migrainosis, and these are very sick people, and it's also dangerous. So typically pain lasting up to 3 days. can be usually unilateral, but doesn't have to be. We have all these side symptoms, and it's aggravated by physical activities. Whatever. Okay. Keep in mind differential diagnosis, like things like bleeding in the head. So then you have a very acute onset of very strong pain. Don't overlook that. Or giant cell arteritis, like old men with often have polymyalgia and it's an inflammation of the arteria temporalis, and they can get blind. So just think of that, don't oversee it. Cluster headaches would be typically men, more during the night and with very short, very severe attacks. Yeah, so there's kind of different therapies, though. Like in cluster headache, you can also treat it with Chinese medicine. It's often blood stasis. You can have good effects. Yeah. Okay. Treatment, as we know, different kinds of drugs. Nicolas, we said how much paracetamol we take. Also new drugs, which work quite well, antibodies, but they have adverse events. And that's the thing. Yeah, that's why we need more or alternative or complementary therapies to migraine, because especially in long-term use, you have all these gastro damage, fatigue, maybe numbness, maybe blockade of the immune system, neurological systems, and so on as adverse events. And it's not always harmless. Okay. Acupuncture is quite well known for migraine treatment. It actually works a bit like has a similar metabolism like drugs. Yeah. It has an induction period, a half-life period, a residual effect period. We know that, so it has cumulative effects. We know that in pain, or for instance, we know that in allergies. Brinkhaus proved that with his series of allergy studies. And so it's very safe. Yeah. Yeah. Let's get into it. This is a case from my colleague, Dr. Stockenhuber. She was so kind to give me a case because I also do herbs and psychosomatic treatment. So I'm not the pure acupuncturist, although I usually needle my patients. And this is kind of a typical paradigmatic patient. Yeah. It's a 34-year-old woman. She has migraine and tension type headaches, which is typical. A long time since puberty. History, she has some constipation, some Hashimoto, some gingivitis, and also she has the cyclical vomiting syndrome, which is often accompanies migraine. But the attacks are not so common. It's about every 3 weeks or every 3 to 4 weeks. But when she has it, it's quite disabling. She has a pain 8 out of 10, stabbing, and interestingly, not in the forehead. I mean, the forehead is pretty common. It's not in the forehead, so it's the rest of the head. And she also has the typical symptoms of nausea, vomiting, phonophobia, and she has problems adapting to weather and stress. Yeah? What is also interesting, she's a lawyer. She's very diplomatic and balanced, so she doesn't show any emotional symptoms. So maybe they're suppressed. Yeah? She has a lot of petechias, could be some blood stasis. She has a livid, pale, thin tongue, but there's no impressions. She takes aspirin and something for the thyroid. So Daniela did a program. She did 10 treatments once weekly in our ambulance of the ÖGA, of the Austrian Society. And she did very classical points, like obviously she did some kidney tonifying. I mean, if the whole head is affected, and it's maybe not so often, like not 2 times a week, maybe only every 3 to 4 weeks, and it's not the forehead, so it seems to be not in the first line a stagnation of liver gallbladder. It's more some kind of weakness. So that's what she treated. She did obviously some kidney tonification and something to bring the yang down. And she changed the treatment only by using optional pericard 6 and heart 7 out of obvious reasons. And a little bit she did air acupuncture, but only once with a permanent needles. And it worked. After 10 treatments, the patient was symptom-free for 9 months, which I think is a very good, considerably good success for such a seemingly simple treatment. Yeah. Okay. And I looked around if I found any evidence, any scientific statistical evidence. And what I found in this frame, 3 very interesting studies. The first one from the US, from Fairfield, Cureus, Nagwit. It's a systematic review of controlled trials. And then Cochrane, a review from Linde and Brinkhaus and Allier, and also a very interesting study about the dose-effect relationships from 2019. So these studies are all around 2020, so they're quite recent. And there was also another study from Chengdu, which kind of confirms these results. So let's look at it. The Cureus study, if primary purpose, efficacy, safety, basically, does it work? Does it have a prophylactic effect? The Cochrane study from Linde, there was a kind of a follow-up to an earlier study because they had done a migraine review and they didn't find a difference between verum and sham acupuncture. So they kind of tried to kind of go deeper, and actually this time they found a difference, just to tell you. It was different groups. It was acupuncture versus no prophylaxis versus sham and versus drugs. Then there was this dose study from Xi Yang, also from Chengdu, and he explored the relationship between the dose of acupuncture, which means the frequency, the duration, and the effect. Okay, then we have all kind of research. They used all the reviews used controlled trials and with grown-ups, also people in the age of consent with over 18. And basically, Linde also only used episodic migraine and the others used all kinds of migraine. They excluded headaches from other causes, basically.
Sorry, 2 more minutes.
Oh, whoa, you're quick. Okay, so we'll go. Then okay, they had all kind of quality, safety and quality regimens. And let's come to the conclusion. Maybe this one is very interesting. These are the most common points used in the Cureus study. So we see gallbladder points very commonly. It's more than 2/3 of the points. So it's like famous points like gallbladder 34, gallbladder 8, and the other side is from the Young study. We see that after this is in the x-axis, we see the months, and here we see the frequency of the attacks in the vertical axis. So after 2 months, which is 8 weeks, we have already a very good effect in the reduction of attacks. Yeah. So that's interesting. That's interesting when you plan your therapy. How long do I have to treat, and how many treatments do I have to make to get an effect? Okay, discussion. You can read that through. Conclusion: the big Cureus study from 21 said acupuncture is a valid and justifiable therapy. It's in par with medication. Is longer lasting, is cost effective, and reduces drug intake. Also, Linde could verify that it's better than spam, although there were some complicated things because spam acupuncture was quite good in comparison with drugs. Then we had an interesting conclusion that there's a non-linear dose response between acupuncture sessions and migraine attack frequency. And they say they recommend 16 sessions of acupuncture with a frequency of 3 sessions per week. But you saw that 10 sessions once per week was also quite good. There was a discussion, what's the minimal dose? They're not quite sure about that. They say about 7 treatments. So when you plan your treatment with a migraine patient, you might tend to say at least 2 months, at least once per week, I would suggest, yeah. And the other study was kind of a confirmation of that. Okay, quality of evidence. That's just a remark to the Linde study. There's moderate evidence, which in Cochrane means that it's quite good. So moderate means the effect is very likely. Okay, good. So acupuncture, there's comparatively less research. Modern drugs, there's of course ample research. In acupuncture, you have longer lasting effects. Modern drugs effects tend to stall when the drug is discontinued and you have side effects. Acupuncture is very safe and it's more cost effective. Maybe the only bad thing is that you have to invest more time to prescribe a drug. Doesn't take any time. Okay, I think then we're finished from the time. How long do I have now? Oops, I don't understand you. You have to put on your
2 more minutes.
2 more minutes. Okay.
Yes, because we started a little late.
Okay. So inside acupuncture, there's a lot of empirical evidence, case evidence. In Chinese, sorry when I pronounce it wrong, it's Tu Feng or Pian Tu Feng, wind in the head. There's different styles, and I would suggest, I mean, you just read through. You can use everything because it's basically a disease of the whole person. There's, as I said, a lot of psychological stuff also, but just what might be interesting for you, you can also use types of points which kind of descend or ascend the qi. Like you would look at the Jingbié, the divergent meridians, which kind of harmonize upper and lower. You would maybe add Pericard 6, which harmonizes upper and lower. So you do everything to bring the whole body into play, yeah. And there's a lot of really interesting literature. And then you look at microsystems, of course. So you combine main body acupuncture with microsystems, and you might use moxa, gua sha, and everything. And you look at blocks to treatment if it doesn't work. Scars, painful areas in the hara, like a very severe emptiness, yeah, like someone who's really tired with a really weak kidney, hidden infections, also food issues and psychological blocks, yeah. So you look at, in the long run, you look at all these things. This is good literature, I would recommend. And you can just, I drew you some nice pictures. You can like look at the topography if you want. So if you have a busy practice with say 20 patients in the morning, you have to be fast, yeah. And then you look at very interesting information about zones, and you have to differentiate them. Yeah? Like for instance, on the side of the head, yes, there's gallbladder, oops, but a little deeper in the deeper muscles and a little lower, there might be triple woma, yeah, and even lower there might be small intestine, yeah. So you can look at that. So you have to be observant and flexible, and these are very good patterns. Vertex can be liver, but also can be bladder, yeah? And these are all different liver zones. This is more stomach. The interesting thing about stomach, it's the whole face. It's except the lower mandible. You might have to use more large intestine. And then there are kind of special zones like a diadem or a crown around the head, some dizziness. And the area above the eyebrows would also be stomach, yeah? So further above the eyebrows, you would use gallbladder, and lower above the eyebrows, you would use stomach. So that's bladder. And here's an example. You might do this pain in the frontal region. You identify gallbladder, and then you treat. You have 4 systems. You treat with these. And if you make a schematic like that, it's like a safety net, yeah? So you know you're going to have an effect. And it's also quite harmonious to do that, yeah? I mean, for the body, yes. So I also asked some of my, here's something about the neck, and then I asked some, okay, we're gone. So, well,
Sorry, it's so
no,
interesting, but we have to
no,
think
that's,
also for
I
the
know,
following speakers.
I know that's totally okay. When I did a rehearsal, I thought, oh God, never gonna get finished yet. So I'm fine. You can have the PDF, you just read through it and maybe you profit.